Hi, everyone. I'm going to go ahead and share my screen. Let's just hopefully that is working. If someone can give me a nod and tell me that they can see my screen, that would help. Thank you, Barry. It's always like, what are you guys actually seeing when I come over here? Thank you. All right, welcome. We'll give folks a minute or two to get in. Thank you, everyone, for joining us. Let's just see. That went much quicker this morning, so I think we're good. All right, give it a minute. I see Troy. I see some faces I know. Thank you, everyone, for joining us. All right, let's go ahead and get started. So you are in the first round of the breakout on asset maps and service arrays. And I am going to just do a quick review from the webinar. If you weren't here with us 2 weeks ago, as a reminder, asset mapping is reviewing the resources, the services, and supports that are already in place in your community and where they're located. And this is a key part of the process of your comprehensive prevention plan. It is a requirement that you do some asset mapping. However, there's not much detail in the CPP instructions on what that asset mapping needs to look like or what you have to turn in. So we're going to talk about asset mapping pretty broadly, and then you're going to need to do some discussion on your own at your county level in terms of exactly what you're going to do for your asset map, what you're able to produce. So we'll talk about some options today. So just a quick reminder, where asset mapping falls from that last webinar. So you have your needs assessment, which identified where the areas of weakness were in your county. That's kind of step one. Step two is what we're talking about now, which is the asset map. So this is where you've identified the areas that you have some need or some weakness where you want to focus. And then you are going to start looking at what's already in place, what's already being worked on to address those problems in your county. So we call that an asset map or a service array. And then lastly, you take that information, the needs assessment, the service array, and you use that in the gap analysis. And there is another session after you're done with this one. If you want to go to a gap analysis session, Mike Steele from Chapin Hall is talking about that in another one of the breakout rooms. And the third breakout room today is talking about logic models and theory of change. So if you're still at that stage, you want to make sure that you catch that as well. All three of the breakouts are being recorded, so you can watch them after the fact if you want to see all three. Okay. All right. So I'm going to share some links. All of these are from the webinar. So if you are new, you may want to grab some of these. Again, as typical for all of our webinars, you'll get an email in about 2 days that has all of the links included. So I'm sharing them here, but don't feel like you've got to copy them all down. The first is a resource on asset mapping. It's basically a list of resources. You can review them, see what clicks for your community. There are many different ways to do asset mapping, and you can pick and choose to do it however you want. However, in the comments and the questions after the webinar, a lot of people have been asking for more concrete recommendations on what to do, and a little bit more of like, just help me a little bit more about how I do this. So what we're going to focus on in this breakout are two really good resources that you can use. One is a guide from Chapin Hall, from the Capacity Building Center for States, which is specifically about a service array. It's got some really great instructions on how to go through, and we'll use that here as we're stepping through the process. So if you like the way we're doing asset mapping, download that guide and it'll give you a lot more detail. The other material that we're going to use today is the Data Playbook, which came from Safe and Sound, and it is an excellent resource on using data in your comprehensive prevention planning process. It is California specific, Again, if you haven't looked at it, I would recommend that you take a look at this, both for comprehensive prevention planning and then also for kind of general work that you may be doing regarding evaluation, needs assessment, so on. Okay, so these are the 3 resources we'll be working with today. Using that guide, the way that the Capacity Building Center for States breaks out a service array is in 4 steps. The first is determining the focus of your assessment, and that is really the needs assessment. So we'll talk about that a little bit more in a second. And then you've got convening some sort of work group who's going to focus on the service array process. Third step is collecting data. Doesn't have to be new data. Hopefully there's existing data. We'll talk about what are some data sources you can use. And then lastly, it's using that data to make decisions, to drive the comprehensive prevention planning process and improve your service array. Okay. All right, so first thing is that needs assessment. You do not need to go into this thinking that you're going to map every single service that's ever provided in your county for primary, secondary, and tertiary prevention. That would be a huge, huge, huge endeavor. So you're going to use the needs assessment that hopefully you have already started on, or maybe already completed, depending on where you are, and use that to guide what you're going to do an asset map on. So that's my first question to the group. Thinking about where you are on this process, has your county already identified areas of need? And if so, can you drop a couple in the chat and we can talk about what are counties already identifying as areas they're going to be focusing on based on that needs assessment. So if any counties have gotten to that point that they're already, needs assessment done and they're already focusing on specific populations, please feel free to drop those in the chat. Give folks a second to see. Okay. So, okay, non-traditional parent education. Thank you, Troy. Anybody else identified a topic of interest? Okay, building capacity for services, mental health, youth, culturally relevant, parent support, DV support, great. So these are all kind of excellent topics that will help you narrow down where you're going to asset map. So for example, capacity building for services, you could focus an asset map on your mental health services, what's currently in place in your county, who are the providers, et cetera. Same thing for parent education and parent support programs. What's going on there? Who's providing those services? I think the key thing is make sure you target your asset map process to your needs assessment. We do get questions from folks who are like, I can't possibly map everything occurring in our county. And that's really not the expectation. You want to use the needs assessment to drive what you're asset mapping. Okay, so that's the first step. Keep in mind that your asset map can still be countywide. So you might look at parent support programs across the county, or you might have identified specific areas of your county that had higher needs. And so you might target it to a regional area. You might have identified needs that were more, special populations, like the example I gave here of families who have substance abuse issues. So whatever the issue is, first you want to frame kind of the context. What are you mapping? Put your boundary around it so you don't get overwhelmed with what you have to collect. Okay. All right. So the second step is convening some sort of work group. And hopefully you have an existing CPP team. And depending on your county, I know we got some counties that have a lot of people on this team. You can get a subcommittee, get a group of people who are interested. So I guess that's a question for chat. Do you already have a group that's working on this? Do you have a group that's working on service array? Has anyone started to think about this yet? And if so, what has your experience been? In terms of who should be in that group, a lot of people get scared of data. Don't have to be, it's not that bad, but you want to make sure that that group or subgroup, if that's who's working on it, is representative. Make sure you include those with lived expertise. We're talking primary and secondary prevention, and you want to make sure that we've got that population represented. So if they're not currently in your team, you might want to do some work recruiting some folks. Also include some data people. That sounds kind of like a no-brainer, but you may need to pull in, child welfare agency staff who work with data, maybe CQI staff. If you have evaluators, you are going to have to look at some data. And so you pulling in those folks from the beginning, is a helpful idea. So that's a question. Has anyone actually started working on service array? You can raise a hand. You can just put yes in the chat. Okay. Oh, excellent. Perfect. Great. So I'm seeing a couple of folks that are already doing some stuff. Excellent. So I might ask you later on to give some examples of, of what you've done. And I can see, excellent. Cindy's talking about some focus groups. And so we'll talk about data collection in a couple of minutes. So thank you for sharing that. All right. So collecting data. First guide for this is always start with existing data sources. And so a lot of times when we think about data, people are thinking about the needs assessment side. What do the families look like? What do they need? This is a little different type of data. In this case, we're talking about services. So who is providing what and where in your community? So just let's put this out to the group. If we can just brainstorm, where can you find information on services that are currently being provided in your county? So if you had to look at mental health services or parent education, for examples from earlier, where would you go to get that information? If you don't already have it, are there reports? How would you try to get that information? Go ahead and drop that in the chat. I'll give folks a couple of seconds to respond. And I think for this one, okay, the places they're being provided, county funded, private providers, perfect. So you got to think about, I often say, follow the money. Who's funding these services? So it could be contracts. So your child welfare, your mental health agency probably has a contracting office of some sort. Who knows? Who are they funding to provide these services? 211, this is an excellent resource. And if you weren't on the webinar, definitely watch the section on using 211 to get data. So 211 is a great way to look at who's already providing these services in the community. And depending on where you are, you can actually pull data right out of 211. And so again, Mike Steele talked about that in the webinar 2 weeks ago. So you can pull that. Annual reports, exactly. There's already data on this stuff. So First Five probably has an annual report, or mental health, child welfare has reports to the board of supervisors. There's already things that you can look at, lists of contracts, exactly. So start thinking about where you might go for some of this stuff. And let me give you a couple other data sources. I'm just going to drop some stuff in chat. So this is a resource from the CEDC. And again, you should have gotten this at the webinar. If not, again, you'll get a full list, but these are some additional places to think about. If you are looking for, where do I go? You don't want to, reinvent the wheel. And then another resource that we talked about at the webinar, if you're really stuck on where to even get started, we have a table from the last webinar that kind of broke out the social determinants of health and protective factors, so kind of key frameworks by service types. And so it might kind of stimulate your group to think about, okay, what are some other service types that we can be looking at and who might be providing those? So I've just dropped the link for both of those. So follow the money, look at where the contracts are. You also might need to think a little bit outside the box. So these may not be places that are necessarily, funded through contracts through county agencies. These could be privately provided. I think as Barry mentioned earlier, they could be, local nonprofits. So we're gonna have to think about what that, where you're gonna get this information from, depending on what you've identified as your need. Okay. All right, and then what are you collecting? So this is an asset map, and you're talking about what is provided and where it's provided. And then to help you as you get ready to do a gap analysis, to note capacity issues. So it's not really enough just to know this service is provided here. You also want to get a little bit more information about any capacity issues, barriers, et cetera. And so I'll give you a couple of examples here. Let's say you were looking at mental health services. Someone mentioned that earlier as a focus, and maybe your county is focusing on, mental health services for young children. So here they've identified a provider. They provide services for kids 0 to 5. They're located in that, zip code 92104. And on a capacity issue, they have a 4-month waiting list. You might also have, a residential substance use treatment service. So get more specific. It's not just substance use treatment, it's a residential program. This one requires that they have health insurance. A food bank. So that's a great example if you are looking at some of the concrete supports area that, you might have food banks in your area. Where are they? Where do they serve? When are they operating? How many people? And so on. I'm going to give you one more tool here. And I just want to remind folks that we're going to use a template that we put together. It's very basic. I'm going to switch and show that in a second. But remember, this is just one example. You can take this, you can download it, you can add it, you can personalize it, you can do whatever you want with it. But again, asset mapping can be done many different ways. So don't feel like you have to use this template, not required at all, just an example. So let me switch over and show that. So hopefully you can now see an Excel spreadsheet. Someone Barry, give me a heads up if you can see it. Thank you. Okay. Barry, you're on my camera. Thank you. All right. So this is, again, it's just a very basic example. If you were like, I do not even know how to get started on asset mapping, here's an example that you could use. So what we've done across the top is we set up some columns. And again, personalize this, do whatever you want with this, but it's just a way to collect information. I like to start with a framework. So the two I'm most comfortable with are social determinants of health and the protective factors. You can pick another framework, and we've talked about some in the webinar 2 weeks ago, but I like these two, the ones I'm familiar with. So it kind of helps orient what you're looking for. So that first one, we had the example of mental health. And so here's an example of you place out in the framework in the health and healthcare area and the social emotional competence of children. That's the area you're focusing on. You've identified mental health therapy as the service that's being provided. And now you're going to provide more information about what that is, et cetera. So we've put together some basic categories. What's the target population? What's the child welfare status, if that's a piece of the target? So in this case, again, this is the example we gave a couple of minutes ago. It's children 0 to 5 who have open child welfare cases. So you're already seeing that there's a capacity piece there. It has to have an open case. Here's a contact if you want to get more information. Who runs this program? Again, if you're going to have to go back and get anything else, have that information. It might be helpful to know how's it currently being funded, so that you can think about, can we expand this? Can we, add on to this program, et cetera, through this new funding? How much does it cost currently? And then some information about clients. So what's the size of the current program and what's the wait list? So most programs can tell you either how many people are on the wait list or how long the wait list is roughly in terms of time. So whatever you can get, that will help you later on in your gap analysis. I'm from the California Evidence-Based Clearinghouse, so I will always mark down, is a specific evidence-based practice being used? And this is helpful because some of the funding that you could use for your comprehensive prevention plan comes from FFPSA, and there are a set of practices that you can fund using those monies. In certain cases, it's a little bit more complicated, but let's at least start to recognize these. And so we're marking, is there a specific practice being used? In this case, this clinic is using PCIT, which is parent-child interaction therapy, and CPP, child-parent psychotherapy. So both well-established practices. They're already collecting some outcomes. So if you wanted to look at how well the program is going, it looks like they've already got some data. And then we made a note in the last column, I think that's our last, oh no, there's more coming, that the program PCIT is fundable under FFPSA in California. You'd have to do a little bit more digging into who's fundable, but that is a practice that's approved. And then we're looking at, again, keeping this in mind of prevention. This is a tertiary program. This is for kids who have open child welfare cases. So they're already at that level. We make mark the zip code. So if you are going to physically do a map, we'll talk about that in a minute. You've got the zip code, at least you can put that in. You can have the whole address. If you know you're going to map, you want to collect more specific information ahead of time. It's as far as we've been told, it is not required to turn in any sort of map with part of your plan, but mapping can be helpful. So we'll talk about that in a minute. And then lastly, just any other comments. I always like an other field. So this is just an example, and you can see we did a second one. There's that residential substance abuse program. You put in your information, how is it funded, what practice are they using, etc. It's just a way to collect information so that you can then, have something you can then move forward with. You may want to have more detailed information. So if you're getting reports from any of these people, maybe the YMCA does a report every year on their mental health services. Get a copy of that report so you have more information and start filing information. You can file things by service type. You could file by agency. You could file by zip code, whatever makes the most sense to how you are, the specific need that you're asset mapping and what makes the most sense in your local community. Okay. So before we go on to talk about new data collection, I just wanted to open up, are there any questions? Do people have comments about any of this? Again, this is just an example of one kind of basic way to start the data collection process for asset mapping.
Jennifer, I have one thing to add.
Yes.
We've been doing it for Marin, and it's important to collect language ability of services. Good. And the wait lists are often different. So
yes, excellent point. Yeah, and I think that's where it's so key to kind of know the local community that you're working, like what the issues are. Exactly. So good point. So you'd add a column in here, services available in blank, and then that would be a perfect example. Like a food bank might not have issues by language, but you're right, mental health services will, that sort of thing. So again, yeah, this is just a template, fiddle around with it, do whatever you want, but it's a starting point. Yeah, great. Okay. All right, we'll have some time at the end so we can circle back to more questions. I'll keep us going. Okay, I'm going to bring us back to the slideshow. All right, so we've talked about getting specific, collecting information. And now, hopefully you can see my slides again. I'm going to assume yes. There's always a question about, is new data needed? So I would always advise people before you collect anything new, because that's work, that's extra time, make sure that you put the call out to your entire planning team to make sure there's not, there's not already existing resource. So before you move to collecting new stuff, just do a double check that it's not, already out there somewhere. And then in terms of new data, this doesn't have to be some massively complicated data collection process. You're not doing, a government funded, research study. You can do this a little bit simpler. So let's think about what are ways that you can collect data based on your needs assessment to help you with your asset map. So go ahead and drop in the chat. I know a couple folks mentioned earlier some data collection they'd already done. So if you want to put those back in, great, thank you. Focus groups are an excellent way to get some quick information. You get a couple people together, you can do them over Zoom. Key informants with key providers, exactly. We've done a lot of that on the CEBC as we're helping with asset mapping. Just find out from folks, a quick 20-minute call with a program director will give you a lot of information, like Barry just gave. Great, we have a 2-week waiting list for this group, but if you need this language, it's 6 months, like things like that. Other stuff, you can do web surveys. Those are a lot easier and there's free options for doing those. Getting together with your planning group. Who on the planning group has access to survey software that you could use for free, etc. Incentives for focus groups are always nice. There may be the ability to fund that through some of the planning dollars under the block grant. So that's worth definitely talking to your county contact about. Okay. And then depend on the audience. Yes. Sometimes even just having, if it's an in-person group for community, making sure you've got refreshments, coffee, something can help. But yeah, an incentive is always helpful. Okay. Yeah. So anything that you can do to tap existing groups, existing reports to get insights is very helpful. I'm just scrolling through. Thank you. Okay. And let's see, another thing that you can do that I've recommended, because we're getting at service array and trying to find where the holes are, is actually doing some case review. So where are you currently referring people? Can you pull it out of your data system? Do you have to pull some charts and see what services people actually got? But actually doing some specific case review, especially if you've narrowed this down to a little bit more tight area of data collection. Great, Cindy, thank you. That's great. Using some funding to pay the site to conduct focus groups and a $100 gift card for participants. Yeah, if you're bringing people in, especially community members, their time is valuable too. So let's make sure that people feel like they're being appreciated and they're being compensated appropriately for what they're participating in and the information they're giving. So great. Okay. So you want to organize your data. Again, we talked, it's whatever makes sense to you: service type, location, target audience, etc. Mapping tools. It is called an asset map, and as people tend to like a picture of what's going on. But a map can be very simple. It does not need to be anything too complicated. So if you're in a county that has some resources, you've got maybe a group that someone who already has some GIS, graphing map experience, great. If you don't, you can print a map of your county and start marking it up. I mean, you do whatever is feasible for your specific situation. If you want to do an electronic map, the Data Playbook, and I'll drop a link to that again, on page 51 has some great resources. There are free places that will help you with data mapping. You got to have some basic skills, and they kind of give some information about that. But I'll be honest, if all you've got is a paper map, then print out a map and start marking it up. Better than nothing. You can always scan it and share it electronically after the fact. Okay. So mapping tools are out there if you've got the capacity locally. The key is to figure out a way to identify where the services are available. And then, oh goodness, click ahead. There we go. So using data, have a data party. This is kind of a sad party, but let's call it a data party nonetheless. Again, in the Data Playbook on page 53, they talk quite a bit about this. So the purpose of the data party is, if you've been working in a subgroup, bring the data back to the larger committee. If it is, maybe you are the whole group, let's get together and intentionally talk about asset mapping in this period of time. You're going to share whatever you have. If you made maps, whether they're fancy electronic ones or printed, marked off maps, whatever it is, share them with the group. You're going to share however you collected the data. So it could be that Excel template that you've personalized and fit your county. You're going to share all that information. If it's an in-person meeting, you could even post stuff around the room and have folks walk around, have some time to review and reflect. If it's a virtual meeting, you can share it all ahead of time and then kind of walk through it on Zoom. But the key is that you want to give the group time to look at this and ask some basic questions. There's more questions in the Data Playbook, page 53, but here's a couple that I think are key. First, is anything missing? Especially if you used a subgroup, is anything out of sorts? Like, hey, you're missing program X that's over here, that's run by this organization. Great, let's fill that in. And then what stood out for you? Was there anything, like looking at this data, is anything surprising you? It's like, wow, we have a lot of resources in this one area of the county. And why is that? And we know that tends to happen because of where organizations are located. But when you're looking at something like mental health services, it isn't unusual to have providers cluster together, but your families are all over the place. So it's starting to think about that gap analysis. And then the most important piece, based on what you learn from this data, just the quick look that you have done, what do you think? What are your thoughts about where this needs to go? And this again is really kind of the start of that gap analysis. So you've got your needs assessment that you already did. You've started to look at your services that are currently available, and you've been thinking about capacity and other issues. And now it's like, okay, I've got this visual representation. Here's these lists. What's my first thought? Like, as you know, and go around, ask everyone to contribute and give their perspective on what they're seeing. And I see Deanna is sharing, we've been looking at data as a very large team, organize the priorities, identify drivers. Now we're holding a smaller group. Good. And sometimes you might need to kind of go back and forth. Have a smaller group, a subcommittee, do the work, and then report back to the large committee. But I think it's key that you use this data party to make sure that everyone who's working on this gets to review it at some level and contribute anything to it and their thoughts as you head into the gap analysis. Okay. All right. And then the gap analysis. And again, Mike Steele is doing a session talking about gap analysis. So when this one is over, you're welcome to switch to that one and hear what he's got to say. But really what you're thinking about with the gap is like it sounds. What's the obvious gaps in that visual that you've presented? So thinking about that in chat, what are some of the common gaps and barriers that we see in service delivery? So Barry mentioned language. What are some other ones in your counties? What are the barriers that you're seeing? Go ahead and we'll share some of those in chat. Lack of providers. Yes, we know that staffing shortages all around, are a huge problem. All right, we've got 2 minutes left, so I'm going to move us through. So think about other things like lack of relational context. Okay, good. Are the services in the right place? That's pretty obvious. You've got your map and your needs assessment showed you where the population, geographic locations. Thank you, Cindy, we're on the same page. Families not in the same location, service providers. I live in San Diego and we have a horrible public transportation system. So it can take you an hour and a half via bus to go 5 miles. So, transportation is a huge issue. How long are the wait lists? Transportation in rural, exactly. Other barriers, transportation, language, accessibility, funding, capacity. So there might be a great program, but there's only 20 slots. And so how do we expand on that? What about outcomes? Let's say you have great services. Everything looks like it's in the right places, but are families staying in services? Are they engaging? Are they completing services? What's the satisfaction, the retention, engagement? And then revolving door of providers. That's a huge issue in many of our areas for a multitude of reasons why providers turn over. But you're right, it does affect the quality of services. Capacity and willingness and ability to deliver EBPs. Yes. And so we'll talk about evidence-based practices more in the next couple of webinar sessions, but all things to think about. All right, before they cut us off for this session, just a reminder, you want to use the needs assessment process to target asset mapping. Don't try to map everything in your county. You can do several distinct mapping efforts if you're working on individual areas. If you're focusing on services for pregnant teens, that's a very unique service versus parent education more broadly. So there might be a couple different mapping efforts. And then get specific as you're collecting your data. Think about the gap analysis and the sort of information that you're going to need to complete that process.